Hello, welcome back to SkepVet TV. I'm Dr. Brennan McKenzie, and I'm the SkepVet. Today I'm going to talk about the safety of vaccination. There's been a lot of concern and a lot of discussion in the media about vaccines in human medicine, and that has influenced pet owners, so that one of the most common questions I get these days from my clients is, are vaccines safe? What are their risks? The first thing to know is that there is nothing in medicine that is completely without any risk. I've already introduced you in a previous video to Mackenzie's Law, which says that if there is any therapy that claims to have no risks or no potential side effects, it isn't doing anything at all. The body is very complicated, there are many parts that interact in intricate ways, and the idea that we can affect just one small thing and not have any potential for unintended consequences simply isn't realistic. So when I talk about the safety of vaccines, what I'm really talking about is how do we balance the risks against the benefits? How do we make sure that the risks are as small as possible and that overall your pet is better off and safer and healthier being vaccinated? Another important thing is to understand how we figure out what the risks of vaccines are. Unfortunately, people commonly come to conclusions about the safety of vaccination through anecdotes that they hear. Someone may tell you that their dog was vaccinated and shortly after became ill. And that's a scary story to hear, and it leads to the idea that vaccines may not be safe. Unfortunately, anecdotes like that simply aren't a reliable guide as to whether a medical therapy is safe or effective. It's very important that when we look at the safety of vaccines, we use controlled scientific research to help us understand what risks there may be. Now, there are a couple of ways of doing this. One of the most common is to use adverse event reporting databases. Most countries have databases that are kept by some federal agency where people can call in and say, I believe that my dog has had a reaction to a vaccine. Or a veterinarian can call in and say, I saw a patient with this illness that occurred shortly after vaccination and it may be related. Those databases collect those reports, and then researchers can go back and look at them and say, how common are certain kinds of reactions and what vaccines do they seem to come along with? The problem is that those are very often just collections of anecdotes. No effort is usually made in the databases themselves to decide whether the reports actually represent a real side effect of a vaccine. Better scientific evidence of the safety of vaccines comes from studies that control for things that might mislead us. For example, that compare the incidence of a certain disease in dogs shortly after vaccination and in dogs who haven't had a vaccine recently, and look to see whether there's any difference. If a disease occurs just as often in an unvaccinated population as in one that's been vaccinated, then you're less likely to think the vaccine is realistically a cause, even though there are individual cases, individual anecdotes, in which the disease followed the vaccination. So using that kind of information, we do have some overall sense of the rate at which vaccine reactions occur. The best evidence that we have is still fairly limited, but we see rates of adverse events or illness following vaccines in dogs and cats somewhere between less than 1 in 10,000 vaccines up to maybe as many as 50 per 10,000 vaccines or 10,000 vaccinated animals. So those are very low rates. Which brings me to the most important point, and I'll emphasize this again. Vaccines are the most effective tool we have for preventing illness. They do have risks, but in most cases, those risks are far lower than their benefits. And if we choose to reduce vaccination or not to vaccinate at all, we are taking a risk as well as potentially preventing a risk. We've seen this, unfortunately, in human medicine. Children are now suffering and dying from preventable diseases like measles and whooping cough at higher rates than they used to because people have become concerned about vaccine risks and are vaccinating less often and less effectively. Now that we've discussed the fact that vaccines do have some risks, but those are very low and probably fewer than their benefits, let's talk about what exactly the risks of vaccines are. There are several categories that I will cover. One is what vaccine risks we know actually are real and do occur. These are things that have been studied scientifically and that we know are realistically associated with vaccines and potentially caused by vaccines. Then there are those risks that I would say are uncertain. There are some studies that suggest vaccines may cause certain kinds of health problems, but there are other studies that don't find that association, and we're not entirely sure whether there's a connection or not. Finally, I'll mention those risks of vaccines that I think are not real, that you will probably read about on the internet or that people will tell you about that I think are unproven at best and often completely made up. In terms of the real risks of vaccines, by far the most common is what we call an acute hypersensitivity reaction. This is essentially an allergic reaction to some component of the vaccine. Allergic reactions often occur within 30 minutes or certainly within a couple of hours in most cases of a vaccine, and they're fairly noticeable. They will involve symptoms like swelling around the face or hives, little bumps on the body, potentially vomiting, a fever. They are often not serious. The majority of acute allergic reactions to vaccines go away on their own and don't require any treatment or go away very easily with supportive care. Occasionally, dogs and cats can have more serious allergic reactions, something we call anaphylaxis. And this does require more aggressive medical treatment, but it is usually curable with appropriate care. Other reactions that we know are quite likely associated with vaccines are something called granulomas. These are little inflammatory bumps that occur at the site of a vaccination. In dogs, these are not very serious. They will go away relatively quickly within a few weeks or a couple of months on their own. You should always have any lump or bump that occurs after a vaccine checked by your veterinarian. This is especially important in cats where they can be something other than a granuloma and can be more serious. Another reaction that we do sometimes see with vaccines is something called vasculitis. It's an inflammatory response in the little blood vessels in the skin. Dachshunds and some other breeds are particularly prone to this, and it may cause loss of hair or scabbing or lesions on the skin. Again, most of the time this is not serious, but it's worth having it checked out by your veterinarian. Okay, so those are the reactions that we are fairly certain are associated with vaccines. Then there are reactions that may be associated with vaccination, but we're not absolutely sure and the evidence is conflicting. The most common and important reaction in this category is what we call autoimmune disease. In particular, something called thrombocytopenia or hemolytic anemia. These are two diseases in which the body's immune system gets confused and attacks either the platelets, which are involved in blood clotting, or the red blood cells, and causes some pretty severe illness in many cases. There have been a couple of studies looking at whether these diseases occur more frequently in a short time frame after a vaccine than in dogs who've not been recently vaccinated. A couple of studies were published in the 90s that suggested that there was a temporal relationship, that these diseases would occur shortly after vaccination more often than not. However, several other studies have been done since then, and they've not been able to find that relationship. So it's not entirely clear whether these autoimmune diseases are actually triggered or caused by vaccines. It's important to understand that there is also a genetic component. That it's not that vaccines necessarily are a primary cause for autoimmune disease, even if they may be a trigger in some animals. There is also an underlying genetic susceptibility, but we don't understand very well which animals might be at risk, so it's difficult to predict that. We do know in humans that this autoimmune response can sometimes occur in children following vaccinations. It's quite rare, but it does occur. An important thing to understand, though, is that the vaccine in humans that it's been associated most commonly with is what's called the MMR, or the measles, mumps, and rubella vaccine. However, getting measles also has been known to cause exactly the same autoimmune disease, and in fact at a much, much higher rate than the vaccine. So once again, even though there may be some potential risk for an autoimmune disease following vaccination, and we aren't actually clearly sure that's true yet, even if that is true, we have to be aware that the diseases that your pet may get if they're not vaccinated carry the same risk and quite a few others as well. So in terms of balancing risks and benefits, right now it seems unlikely that autoimmune diseases are frequently triggered by vaccines, but they may be in some susceptible individuals. This is not a reason to avoid vaccination in general. If you have a dog who has had an autoimmune disease, you should discuss with your veterinarian the relative risks and benefits of vaccination. In some studies, we actually have looked at dogs with these autoimmune diseases who have subsequently been vaccinated, and the vaccines have not triggered any relapses or cases of these diseases that we know of. So it may still be safe to vaccinate your pet, but you should discuss that with your veterinarian. Perhaps the most serious medical consequence of vaccines that we know about with some certainty is what are called injection site sarcomas. And I discussed this in a little more detail in my video on cat vaccination. Essentially, cats have been known to develop some pretty serious tumors at locations where they've had vaccinations, where they've had other kinds of injections as well, where they've had microchips or surgeries done. Anything unusual or foreign that enters the body could potentially trigger the development many years later of a pretty serious tumor. Now, again, the incidence of this tumor, how common it is a subject of some controversy. For the most part, it's considered to be quite rare. So if your pet is at risk, if you have a cat who goes outdoors and is at risk of infectious diseases, vaccination is most likely going to be much more likely to benefit your cat than to cause these injection site sarcomas. But again, you should discuss the individual circumstances of your cat's needs with your veterinarian. Finally, I'd like to discuss some purported health problems that have been blamed on vaccines which probably are not actually caused by vaccines. One claim you may hear is that too many vaccinations may overload your pet's immune system and cause autoimmune disease, which I've already discussed, or other health problems. There's really no reason to believe that this is actually true. And in fact, some interesting work has been done in humans looking at how much stimulus our immune system gets from all the vaccines that we get as children, and comparing that to the kind of stimulation our immune system gets from an ordinary disease like a cold, or from everyday living. Every time you brush your teeth or get a paper cut, your immune system is exposed to infectious organisms and stimuli that cause it to react. It turns out that this kind of everyday exposure far outweighs any exposure from even all of the vaccinations you're likely to get in your lifetime. So the idea that your immune system will get overloaded by too many vaccinations really doesn't make any sense. And the same is true for our pets. It sometimes seems like we're giving puppies and kittens an awful lot of vaccines because they're at a time in their life when they're most vulnerable and when they're building their immunity to infectious disease. But the reality is that those vaccines are a drop in the bucket compared to all the other things that your puppy or your kitten may be exposed to, and their immune system is well equipped to handle that. You may also have heard that vaccinations can make your pet more likely to get sick, either because their immune system is stressed or suppressed in some way, or because the vaccines themselves can cause illness. This is, again, not a real risk that you should be concerned about. There have been studies in both humans and in animals looking at whether or not people or dogs and cats are more likely to get sick after having been vaccinated, and there's no consistent association there. So if someone tells you that this vaccine could potentially cause your pet to get ill, there's simply no science to back that up. Another claim you may have heard is about toxins in vaccines. Toxins is one of those words that's very vague and often used to scare people without actually having any real meaning in a health context. There are many components in your vaccines. There are the antigens, or the part of the infectious disease that we're trying to teach the immune system to respond to. There are vehicles, things that carry that antigen, preservatives sometimes, adjuvants, things that stimulate a stronger immune response. All of those things are studied quite extensively, and most of the claims about their risks simply don't hold up when researched. One of the things you may have heard most commonly about is something called thimerosal, which is a type of mercury compound that was often blamed by anti-vaccine activists for causing autism or neurologic problems in children, and which sometimes pet owners have been taught to be afraid of. The reality is that there is no research showing that thimerosal causes any of the health problems that have been blamed on it. It has been removed from many childhood vaccines out of an excess of caution, and doing so has had no effect at all on the incidence of autism or neurologic disease in children who are vaccinated, so it doesn't seem to have made any difference. And there's no evidence at all that it's a compound you should be worried about for your dog or your cat. So in general, when people talk about whether vaccines have toxins in them, it's usually a signal that they don't really understand the science of how vaccines work and how they're developed and how they're tested for safety. Vaccines, as I've said all along, do have potential risks, but the vague notion of some toxic or poisonous component to the vaccine is not a real risk that you should be concerned about. You may also have heard the term vaccinosis. This is one of those terms that I think should immediately raise a red flag for you that whoever you're listening to or whatever source you're looking at is of questionable reliability. Vaccinosis is a term that was originally coined by homeopaths back in the 19th century to suggest that vaccines, which were newly being developed at the time, caused all kinds of illnesses. Pretty much anything that happened to a person who was vaccinated was blamed on vaccines and called vaccinosis. It's a very vague idea, and there is no legitimate scientific evidence that it even exists as a disease or that it represents true risks or health problems caused by vaccines. So be aware that if you hear the term vaccinosis, it's a largely meaningless term, and it does suggest that whoever you're looking at or reading or listening to has an idea about health and disease that is not soundly scientific. Okay, so now that we've talked a little bit about both the real and the imaginary risks of vaccines, how do we go about reducing the risks that vaccines pose to your pet? One strategy for reducing the risks of vaccination is to give fewer vaccines, and it seems like a reasonable idea. We've talked in previous videos about how vaccines are often given on the basis of the lifestyle or the particular individual risk factors of individual pets. And the idea behind this is that we end up giving fewer vaccines because we're not going to use them in a situation where the individual animal is unlikely to be exposed to whatever we're trying to protect them against. A classic example of this is an indoor cat who's had a normal kitten series and a 1 or 2 year booster vaccine and is never going outside, never exposed to other cats. We may not vaccinate that cat at all, or certainly not as frequently as a cat who's routinely outdoors and exposed to lots of other potential infectious organisms. The idea behind this is sound, but you should be aware that there isn't actually any really solid evidence that reducing the number of vaccines your pet gets in a lifetime is safer or makes them healthier. The health risks of vaccines do seem to be associated with genetic and individual and breed factors, and they're a little bit unpredictable. The total number of vaccines your pet gets in a lifetime probably isn't a major factor. Nevertheless, it's reasonable to try to avoid any unnecessary medical therapy, and so the guidelines for vaccination of dogs and cats have evolved over time with an idea to reducing the number of vaccines we give and only selecting those that seem most useful and most important. There is also research ongoing to try to understand the risk factors for adverse reactions to vaccines. As I mentioned, some breeds are far more likely to have reactions than others. Small breeds in particular are known to react and have these acute hypersensitivity responses more often than larger breed dogs. And one of the strategies for minimizing the risks of vaccines is to understand who is most at risk and to change our vaccine plans to help reduce those risks. So for example, it's often recommended for smaller breed dogs to separate vaccines more in time, to give fewer vaccinations at one time, because we believe this may reduce the risk of adverse reactions. Now, this has led a little bit to some confusion about the concept of what's the appropriate dose of a vaccine. Dose is a term that we use when we talk about drugs or medications. Most drugs work by being distributed throughout the tissue of your pet's body, and they achieve a concentration in all the tissues everywhere in the body. Wherever that drug is supposed to work, how effectively it works and how many side effects it may have is related to how much of that drug is in the body and in particular tissues. So if you have a larger patient, you give a larger dose of drug so that you get the same amount distributed throughout the body. And that's why we dose medications by weight. However, vaccines work very differently. The immune system reacts to vaccines by having what we call an all or none response. If you get just a tiny, tiny little bit of antigen of the part of an infectious disease organism that your body is supposed to react to, if it's below a certain threshold amount, your body won't react to it at all. You'll get no response. If it's above a certain threshold, then your body will go, oh, that's a dangerous organism, let me develop an immune memory response. And you will have a complete and lasting immune response to that organism. The analogy that I often use is that a drug is sort of like a dimmer switch on a light. If you give a little bit more or you turn the switch a little bit more, the light's brighter and comes on a little more strongly. A vaccine is more like a regular old-fashioned flip switch for a light. If you push it a little bit but you don't reach that threshold, the light doesn't come on. Once you reach that threshold, the light comes on completely and you can't make it go on any more or any brighter. So the notion that you should dose vaccines like you dose drugs by body weight doesn't really make a lot of physiologic sense. And some of the research out there that has been done purporting to show that lower doses of vaccines, that cutting a vaccine vial in half, for example, when you give it to a small breed dog, might be safer, really isn't reliable or based on good science. When we talk about the risks of vaccines, it's important also to be aware that if we are concerned about vaccination and we want to reduce or avoid vaccines, we have to consider what the alternatives are. As I mentioned before, not vaccinating is not a very good alternative. We've seen the consequences of reduced vaccination in children who are now suffering from vaccine-preventable diseases around the world that they need not suffer from if we had vaccinated them appropriately. And the same risk is certainly possible for dogs and cats. If we talk about natural immunity, the fact that your immune system can learn to recognize an infectious organism after having had an illness and may have a lasting immune response, we have to be aware that this requires getting sick. Someone says to you, well, it's safer to take your dog to the park and let them have a little bit of parvovirus exposure rather than getting the parvovirus vaccine, then that person does not understand immunology or the serious risks of getting sick with parvovirus. An illness may generate an effective immune response, but at a much higher cost than a vaccine. The risks of getting sick are always going to be greater than the risks of vaccination. Sometimes people will talk about alternatives to vaccines. Something called homeopathic nosodes, for example, are one alternative, or various herbs or other supplements that supposedly strengthen the immune system, there's absolutely no reliable evidence that any of these alternatives work, not even as effectively as vaccines, but at all. So I'd be very wary of anyone who tells you that they have an alternative product that can protect your pet as well as vaccines without the risks. Partly because there's no evidence to show that that's true, and partly because of Mackenzie's law. If they say there are no risks, it's because that product isn't doing anything at all. Finally, we do know that individuals who are ill, who are stressed, who are undernourished, or experience things that can potentially reduce the functioning of the immune system are more vulnerable to infectious disease. This has led some people to think that the alternative is true, which is if you have a healthy immune system and good nutrition, that you will be invulnerable to infectious disease. Unfortunately, this is not true. Healthy young people and healthy young animals become sick with infectious diseases all the time. So while it's certainly great to keep your pet as healthy as possible, to provide good nutrition and good care, there is no reason to think that that's a substitute for vaccination in terms of protecting your pet against serious diseases. Okay. So I've talked a little bit about the risks of vaccines, the real ones and the imagined ones as well. I just want to emphasize finally that vaccines are very safe and very effective. In contrast, without vaccines, infectious diseases are very common and very serious. So your pet is almost certainly going to be healthier and better off if you follow the recommended vaccine plans that the American Animal Hospital Association, the World Small Animal Veterinary Association, and the American Academy of Feline Practitioners recommend for your dogs and your cats. Thank you, and I'll see you next time.